learn more and more about the coronavirus, one thing is becoming apparent. According to the CDC, the people who succumb to this illness have one startling thing in common: their race. News 5's RENAE Skinner has more on why this is happening.
The black faces of COVID-19 outnumber all other demographics. The data, according to the CDC, is clear. But what's so complex about this reality is why. Now, the experts I've been speaking with tell me the coronavirus does not discriminate. But unfortunately, our healthcare and economic system has.
Structural inequalities are a result of structural racism.
How did we get here? Let's start with the past. Dr. Eric Wallace, Associate Dean and Professor of Medicine at UCCS, says the data is nothing new.
The inequities that we see in healthcare and in race and ethnicity have been historical. They've been here for a long time, and it's not easy to change those.
Dr. Wallace tells me when one category of people are considered unequal in society, the effects of that linger, making its way into our schools, our jobs, our housing, and our healthcare system.
You may have a population where you have a decreased access to healthy food, lack of transportation, lack of high quality education.
Now you compound it by this deadly disease. I mean, it's no surprise that we're going to get hit harder.
Plus, African Americans are having a hard time self-isolating.
And it's not because people are irresponsible, they're not socially distancing. It's because the circumstances don't allow them to work in a space that's safe.
In many instances, it all depends on where you work.
You also may be employed and have a job that doesn't provide health insurance, that doesn't provide sick pay, that doesn't allow you to work at home.
There's also fear of discrimination. Isaac Costley teaches kids how to fight back responsibly. He owns a martial arts center in Colorado Springs.
What is a person of color supposed to do?
Costley says for men of color, the reality is if they wear a mask or bandana to cover their face, they could be racially profiled.
All it takes is a phone call for a suspicious male, black male. Do we risk getting sick? It makes you make a choice.